thankfully we got that medicine, and he has just celebrated over 880 days seizure free,
And so,
which means that his life is transformed.
can you explain why Alfie needs medical cannabis and how accessible it is?
Well, yeah, Alfie has, as you say, a very rare condition called PCDH19. And up until he accessed medicinal cannabis on the NHS, he was having up to 150 tonic-clonic seizures a week, which always required hospital treatment. And he had absolutely no quality of life. I took him to Holland in 2016 to treat him legally with a paediatric neurologist using cannabis. And it worked really well, and we've had a prescription funded by the NHS since June 2018, after we had to launch a campaign in the media and ask Theresa May to allow us to access this medicine. And thankfully we got that medicine, and he has just celebrated over 880 days seizure free,
And so,
which means that his life is transformed.
what you're campaigning for now is for other children, other patients to have similar access.
Yeah. Absolutely. The law was changed on the back of the campaign that we ran. Sadi Javid, who was the Home Secretary at the time, said there was enough evidence to say that this law could be changed and allow specialist doctors on the NHS to prescribe this medicine and for it to be funded by the NHS. The reality is that even though the law has been changed, the policy has not been enacted. There's only 3 prescriptions on the NHS in the last 4 years, so we're coming up to the 4-year anniversary. And even when I work with lots and lots of families who are trying to access this medicine, even when doctors do want to support families, they are, as far as I can see, being blocked from doing that. So the only access is privately. So we have a private, I don't know many people know that, but medical cannabis is available privately. There's around 20,000 patients in this country that are accessing private medical cannabis. So it feels as if you have the money, you can access it, but if you don't have the money, then you can suffer. And that's what I campaign against. It's not fair. You know, we need fair access. And when I saw Therese Coffey talking about being the patient's champion, I really feel that she needs to sort out this mess.
How expensive is it doing it privately? Not that I'm suggesting that people should have to. And also, how just distressing has it been for you? Because you're already dealing with your child having this, I presume, still quite scary condition, and having to campaign at the same time for the very thing that makes it less so.
Yes, it feels very, very unfair. I think the fight that we had, I felt, changing the law would help many, many people, and sadly it hasn't, which is why I continue to campaign, because I want to live in a fair society where access to healthcare is for everyone, not just few people who are managed to do campaigns. And the fact of the matter is it's very expensive for children, especially if they want to access epilepsy treatments on a private healthcare basis. It's up to £2,000 a month. This is families who, I'm sure you're aware, are fighting for social workers, respite, parent carers who, I'm afraid to say, as far as I'm concerned, aren't seen properly in our society. I think many people think, well, you're the parent, it's your job to take care of your disabled child. Well, no, none of us come into this world wanting to have a disabled child. It's something that happens to us. There isn't enough support from the state. And then these people are having to now fundraise, sell their homes, ask their friends to help them with money to pay for medicine. That simply is not acceptable, and I think is sort of a demonisation of people who are already very vulnerable. And the fact of the matter is people wouldn't pay thousands of pounds a month to keep their children on this medicine if it didn't work. There is a huge amount of evidence through real world evidence and observational data that this medicine is very, very safe if clinically led. And that's what we're asking the NHS to do, is to engage with us and ensure this medicine is available as per the law change.
So, Hannah, do you understand the reticence from the NHS for prescribing it? I mean, as you say, it works. It's clearly quite expensive.
Well, it's not expensive compared to having a child in high dependency unit every week, which is up to £200,000 a year. It's very, very cheap. It's around £24,000 a year. So actually the NHS would be saving a lot of money if they allowed, there's around 37,000 children in this country with very severe epilepsy. So they'd actually save money if they introduced it. I think doctors groups such as the Royal College of Physicians and the British Paediatric Neurology Association talk about the possible dangers of THC and there not being enough evidence. But what I would go back to is actually most drugs that children are given in a hospital setting are unlicensed or off-label. They are not trialed as normal drugs like adults have in pharmaceuticals. So, it's very hypocritical to say, oh, we're worried about giving these drugs because they haven't been trialed. Well, most drugs actually that are pharmaceutical drugs that are given to children aren't properly trialed. And I would also say we're talking about children who are at the end of their lives. A lot of the time they have tried the ketogenic diet, they've tried anti-epileptics, they've tried everything their doctors have said. And it feels as if some doctors would prefer to see children go away and suffer than prescribe an unlicensed medical cannabis product, which just seems absolutely crazy. I think it's born out of a lot of stigma rather than actually lack of data or lack of evidence that it works, because it really does work. It can change lives. And the other thing that I really care about is parent carers mostly are women who are stuck at home taking care of very sick children, and we really want to get these children well so women like me can go back to work and actually be part of society and earn money and pay tax and go out with their friends, which I couldn't do for 6 years because my child was so ill. And it really matters to me that those women are seen and we get them into a place where they are able to access a life that actually benefits them as well as looking after their child.
Hannah, as I understand it, there is some good news. 3 private manufacturers have agreed to donate medical cannabis to children going through the lengthy process on the NHS. What's your reaction to that news?
I think it has its place for new patients. So there's about 90 children prescribed medical cannabis products using other companies' products. And I think it's really important to say that these oils are very unique. They're made with very different what are called cultivars of cannabis. So they have different compounds that all have medical value. So it's not as easy to say that if you're on one product that you can swap to another product and you'll get the same outcome. That's actually very dangerous when you've got seizure control or reduced seizures. You do not want to be moving to another product. Actually, the GMC would recommend that you don't do that. So if you're having benefit on a pharmaceutical, you wouldn't just move it to another product. So it will be helpful to new patients. And I think it's a very welcome move from these private companies. It is only for a 6-month period of time. That's quite a short period of time. So I think it's good news, but it's not the answer. The answer is to ensure that medical cannabis products that people are using now are funded by the NHS, whether that be funded via the private sector or funded via doctors prescribing it through the NHS. It needs to happen. And at the moment, the government have just pushed back for the last 4 years and said, well, we've changed the law, doctors can prescribe if they want to. That was Matt Hancock's stance. And now it's that actually there's not enough evidence, which is just simply not true. And actually is putting many children's lives at risk, and vulnerable people are really suffering.